Dorothy, I have a question for you. Does a person with dementia need to wear a mask?
I would say it's a little bit dependent on the situation. If, for example, it's for people who are living with dementia, and I'll speak for our residents who are here at the moment. Um, they are not aware of COVID-19 and that there's a global pandemic, or even why we're all wearing masks. They live very much in the present. They know what's right in front of them, for better or for worse. This looks good, this person looks friendly, this doesn't. But they're blissfully unaware of the kind of collective trauma that's going on out there, and that's a good thing. I say honestly, sometimes I envy that. It's like, oh, just the ability not to think about it for a second would be wonderful. But that said, uh, I know in many different care settings, independent livings and assisted livings, for the safety of all the residents and everyone, they can't gather together. They have to live their lives in their in-room. All the meals in room, all congregate dining is done, because we're memory care, and people living with dementia, to be confined in a room would be really impossible. And there are a number of things that, just because of the dementia, because I cannot understand why I have to do this, and I've lost my impulse control because I have my frontal lobe is not working the way it used to. I can't hang on to why I'm supposed to stay in the room, or why I'm supposed to wear this mask, or if I have oxygen, why do I have this cannula on? I'll be taking things off all the time, and it would be a constant fight, the way many people fight about walkers. Like, you got to use your walker, the same kind of thing. You got to use your mask. So when you find yourself in that endless loop of repeating and correcting and arguing, take a time out. If something doesn't, it's not going to go away. When do you wear a mask? So the question here is, all of our staff wears masks because we're healthcare providers, and this is not a bubble environment. We go to our homes, we come back. It's a safety thing. In people's own homes, the caregiver might not need to wear a mask 24/7, depending on the risk level in your community and what your personal things are. If you are a healthcare professional that goes out into an acute care setting that has COVID, that's a whole different question when you come home to care for your loved one. But in a regular environment, you the caregiver might not need to wear a mask, and the person living with dementia doesn't either, unless one of you is showing some, you might not have COVID, but if someone has a cough or a runny nose, then it's time for the masks, and that's COVID or not COVID generally. But if the person refuses to wear the mask or just can't understand it, you can't win that fight. So